Hi everyone. Thank you for joining this webinar from wherever you are in the world today. I am Dr. Abby Miranda, the Head of Early Years and Prevention at Anna Freud. It's a pleasure to have you all this afternoon with us. Today's Early Years in Mind webinar is going to focus on trauma in the early years, birth trauma in particular. Can we have the next slide, please? I'll go through some housekeeping notes for you before we start. You'll have closed captions available during the webinar. And if you click on the closed captions button, you'll be able to enable these. That is at the bottom of your screen. The chat function is disabled during this webinar. So if you have any questions, please submit these via the Q&A function. There is also an option to upvote any popular questions, so they will be brought to the top of the question list. The webinar will be recorded and available on Anna Freud's YouTube channel, so please do share the link with anyone who wasn't able to attend live this afternoon. This is the programme and the outline for the day, so I'll start by giving an introduction before handing over to the speakers so they can introduce themselves. And we will finish off with a panel discussion, and you'll have the opportunity to put some questions forward to the panel of speakers before we wrap up to close at 6 p.m. Please, can I have the next screen? The webinar today has been inspired by a resource created by Dr. Grace Baptie, who you'll hear from shortly. And this resource has been sent to all of you who attend, and it will be available on our Early Years in Mind network website, which is hosted on the Anna Freud page. Here are some clips from the resource so you can get a flavour of what we will be talking about within the resource and what we'll cover in the webinar today. So just to give you a bit of context to what we're doing today and the webinar, and just to say that when I mention the term mothers, I'm referring and being inclusive to mothers and birthing people, bearing in mind trans men and non-binary people as well. So in general, having a baby is seen as a joyful occasion, something that we look forward to. And this can make it hard for mothers and birthing people to acknowledge when things are difficult and the experience of giving birth has been hard. Society gives us direct and indirect messages about womanhood and motherhood, parenthood, that can make it easy to dismiss birth trauma as something we have to get on with or just get over. And many of you will have come today because these experiences will have resonated with you in some way or another, either personally or in your work. Birth trauma has come into focus over recent years in England. In 2020, Donna Ockenden led the review of the Shrewsbury and Telford Hospital NHS Trust. The review was necessary given that there was an excess of maternal deaths, neonatal deaths and stillbirth, and babies experiencing lifelong complications due to a lack of oxygen at birth. The review concluded that safe staffing, a well-trained workforce, and a culture of learning from incidents was required to make improvements. More recently, former MP Theo Clarke led on the birth trauma inquiry, which was published in May this year. The experience relayed in this report actually brought back personal memories of my own birthing experience with my first child. So not only was it hard to read the experiences of other mothers and birthing people, but the impact on the developing relationship between the parent and baby and existing relationships between partners was mentioned too. This really resonates with the work that we do at Anna Freud because we believe that positive mental health is nurtured in the early years through strong parent-infant relationships within connected families and communities who have access to adequate care and resources. Now, moving on briefly to talk about gynaecology. Gynaecology and women's health in general has had a dark and troubling history, which we don't have time to go into now, but if you look up Dr. James Marion Sims, if you'd like to know more, So, as a woman of South Asian heritage, it is important for me to spotlight how birth trauma can be amplified depending on a person's race or other factors like socioeconomic status, English language speaking ability, previous history of trauma, as we mentioned, gender identity, sexuality, and disability, to name a few aspects. In 1879, British medical student Robert Felkin documented observations of C-sections that were performed in pre-colonial Uganda. These operations were undertaken safely with consideration to sanitation and hygiene, and it was so remarkable that he documented how well embedded these procedures were. So despite the history of Black African countries pioneering safe birthing procedures, Black women in the UK experience higher rates of birth trauma and stillbirths and complications that result in death. And these have been highlighted in the Egbase report. This is also the case for Asian and mixed heritage women, and these disparities cut across socioeconomic status. It is important to acknowledge that there are lots of underrepresented people's experiences in addition to this. So today we brought together a panel of speakers who have active roles in research, teaching, practitioner policy influencing, lived experience and medical background, so that together we can be more informed about how to support families that we come into contact with where birth trauma has been affected. Because we know that while we can't change the past, we can be more supportive to nurture positive relationships that we know are so instrumental in healing the effects of trauma. So I'd like to introduce our first speaker, who is Dr. Grace Baptie.
Thank you so much, Abby, and thank you for inviting me today. As Abby said, I'm Dr. Grace Baptie. I'm a researcher in women's health and specifically in perinatal mental health. And I first entered the world of birth trauma during a research project that I was doing for my PhD. And I put out an invitation for parents who had given birth within the last year to complete a couple of questionnaires, have a short chat with me over the phone to talk through their birth experiences. And I was overwhelmed by just the number of responses that I received to that call. But I was also overwhelmed by the openness of these mothers to share their stories with me. And at that time, the narrative in the research world around birth trauma was mostly focused on physiological trauma. Birth was seen as traumatic if there were obstetric complications like postpartum hemorrhage or severe tearing. And actually, if you went on a database of academic literature and you type in the words birth trauma, about 99% of the hits that you would get back would be papers on physiological trauma, and only 1% of the papers that came up were related to the psychological trauma or PTSD and the impact of birth. But this narrative really didn't fit with the stories that I was hearing from women who had agreed to share their birth stories with me. And although the physiological experience of birth often did come up in our conversations, most of what was traumatizing for these women were related to their subjective experience, like how they felt, how they were made to feel during labor or during their birth or immediately postpartum. And often when women reflected positively on the support they received, this would be a huge buffer against the potentially detrimental impact of a birth where there were obstetric complications or interventions. And whereas when women felt alone, or they didn't feel listened to, or they felt ignored or powerless or dehumanized, or as one woman said, as though they were on a conveyor belt, these feelings can really dominate the whole narrative of the way their baby was brought into the world, regardless of whether on the hospital notes it looked as if the birth was straightforward or without complications. And those feelings can evoke this ripple effect into all aspects of their life during these early years. And what the evidence shows us is that these ripples can impact a mother's relationship with her newborn and the way she perceives her bond with her baby. But it can also impact her relationship with breastfeeding, her relationship with her partner, her relationship with healthcare providers and maternity staff, her feelings about future pregnancy, and her own mental health and well-being postpartum. And we know already that 1 in 4 women in the UK are affected by mental health difficulties postpartum. And possibly one of the most devastating statistics in this country is that suicide remains the leading cause of death for women in their first year after birth. And I'm not saying that this is directly linked to birth trauma, but what I am saying is that it's complex, and there are lots of factors of which birth trauma can play a part. And for some women, it plays a significant part. And as well as being a researcher in this field, I also trained as a birth doula. And so speaking with that hat on, I can't underestimate the importance of birth as a transformative and transcending life event for the whole family. The birth is where babies are born, but it's where parents are born too. And if we don't, as a society, value that and support that, then we're setting families up at a huge disadvantage with a narrative that tells them that the system doesn't care or that the village doesn't care. And for me, it was reassuring to see this topic of birth trauma has come up as a priority in the early years in my network at Anna Freud, as it speaks to the growing awareness of birth trauma. But it also speaks to the growing recognition of the impact that birth trauma can have on the whole family, and the importance of coming together across different disciplines and different services to support families is in a kind of preventative approach with the early years. And for the last 3 years, I've been working as a policy and research associate for the National Centre for Family Hubs, where we've been supporting the Family Hubs and Start for Life programme, which is all about bringing different services together to support families with children of all ages right from pregnancy. And so we know that having that supportive network, or having a village, as I like to call it, is one of the biggest protective factors that can mitigate against some of the consequences of a traumatic birth experience. And so we have to come together on this. And it's just really reassuring as a researcher in this field to see so many different perspectives and disciplines come together on this topic today. So thank you very much.
Thank you so much, Grace. And there's a lot in there of what you just said, I think, that we'll pick up on the panel, but I really loved how you described the ripples and thinking about birth as also a transformative experience. And I loved what you said about, that the parent is born then as well as the child. So we'll pick up on a bit more after we hear from our panel of speakers, and I'll introduce Lorna next to introduce to the audience.
Thanks, Abby. Hi, my name's Lorna Crossan, and I am a parent participation assistant at the Anna Freud Centre. And I work with the Early Years in Mind team, where I provide some input into the themes and resources for Early Years in Mind. And that's basically from my own lived experience as a parent and personally as well. And this is a particular topic that is really close to my heart. So I'm really pleased to be here. And I'm just going to share a little around my experience and what I think impacts potential birth trauma and what can help. And if I'd like us to think of ourselves as delicate flowers. And if you think of this delicate flower and its environment is that of, it's got nutrient-rich soil, it's safe, it's secure, it's really nourished, it's really open, able to express, not repress. It's really seen and heard and really able to weather any storm. And then if a storm comes, perhaps it's got a cane to hold it up, that kind of thing, and it's maybe even got a guard around its stem, but it's got really nutrient-rich soil. It's really stable, secure, protected, and safe, and cared for and looked after. And in terms of ourselves, in our environment, the elements of our environment can support as well ourselves to feel these things safe, secure, stable, protected, cared for. and can really support positive mental health and well-being. And this for us, you know, it's like the company we keep, how we manage pollution, the roles, the jobs, the places we go to, the challenges we have, the storms we weather. These are sort of elements of our environment. And particular times where we feel most vulnerable as we go about our every day. And about times in our life where we feel more vulnerable is times like such as during pregnancy and also during childbirth. And this is where the environment is key, and it really needs the utmost attention. As environment caring, you know, is there a feeling of being cared about, protected, safe, secure, heard, seen, understood? There's a lovely quote by Christian Morgenstern: home is not where you live, but where they understand you. And so during pregnancy and also during birth, the environment, as I say, needs to provide all those things. And if there's any complications or, you know, the potential of a traumatic at birth, it makes all the difference during that experience of how it may or may not affect us. If we have the correct environment, we can weather the storm so much better. Just like that plant, you know, that feels safe and is protected by the cane or the nutrient-rich soil, so it still keeps its strong foundation. And with that, you know, it's like it'll help release those really beneficial hormones like oxytocin, which we feel when we feel cared for, we feel when touch or even the tone of voice are where we just feel safe and we feel cared about, and there's a feeling that emits of kindness, support, love, and it releases those feel-good endorphins. So, you know, if we talk about the example of expecting a baby, you know, you write up a birth plan, you're hoping for a natural birth, you adapt it as you go, you attend the antenatal, NCT, Lamaze, you do the hypnobirthing practice to prepare for natural birth, the anticipation, you find the perfect pram with all your research for those first important outings, you buy the best next to me crib, the best breast pump, the best bottles. So you've got this vision that you've created in your mind, and that's just what the mind does to prepare. But what if that vision doesn't unfold as we expect and the unexpected happens? What if it doesn't go to plan? Well, it feels like being hit by a juggernaut. And whatever that may entail, the environment is so vitally important to help also maintain a balanced nervous system. You know, the place, the people, the tone of language, body language, facial expressions, all those subtleties of interactions. It's like a holding space to deal with within the unexpected is of vital importance. And it's to maintain that feeling of feeling safe and feeling protected and knowing that everything's going to be okay. It keeps that richness, like the plant and the nutrient-rich soil. It's sustained and it's nourished to ensure that we still remain in that place of safety. And you know, things like, as I say, the pace, you know, are the staff walking around and they're not rushing around? You know, are they going at a normal pace? Are they rushing around? Is there communications of a calm tone? The smells, the aesthetics, the lighting, all those kind of things really help create a calming atmosphere that emits feelings of safety and feeling safe, secure, protected, to weather that, you know, whatever it might be that comes up as the unexpected. And you know, if things that don't emit feelings of safety and of security, it can make us feel unsafe. And that's when we'll repress, and this is when we can run the risk of things of trauma. you know, where there's lack of information, there might be powerlessness, lack of control during birth, low levels of support. And, you know, emergencies don't really have to be traumatic, but when they're mixed with what I just said, with the feeling powerlessness, so if you're feeling unheard or unseen, or there's lack of information be passed on, perhaps the birthing parent has provided information and that hasn't been passed on to the caregivers, and they don't know about that. That can have an impact as well. And all, you know, all are preventable, all can be addressed. And it is things, it can cause issues further down the line. You know, it can affect breastfeeding ability due to sort of remaining in that fight or flight response. It can cause physical problems like irritable bowel syndrome, panic attacks, eating disorders. The trauma can lead to mental health problems and hypervigilance, especially if you're still in the fight or flight mode, and also can be having flashbacks. So, you know, going back to that environment, when complications and the unexpected comes up, it's really fostering an environment that really emits love, respect, being valued, being understood, feeling safe, feeling seen and heard, and being able to express your needs and wants, and having agency. So, and you know, that then allows for those strong roots to be sustained. So that even if it is a complicated birth or trauma happens, the impact is not long lasting. They're able to process it there and then, because, you know, we know that trauma can be held in the cells in the body and later on have a long-term effect. So, and in terms of the early years environment, you know, I think there's a lot that can be done when, you know, post giving birth, to, you know, in terms of offering a caring environment, nurturing environment, welcoming, promoting self-care practices that allow parent carers to come home to themselves. So things like an affirmations jar within the setting, something like a time to be corner or a pause for peace corner where the parent and carer can go, story massage, maybe once a month time. So self-care practices poster, maybe even have poetry displayed in the early years setting, about healing, about new parent stories, poems that are maybe anonymised birth stories as well. It just gives that sense of, oh, it's not just me, and it brings people together. So really as well, fostering community and connection, making it really inclusive, focusing on human relationships, perhaps even creating a welcoming support circle for parents that really helps them relax and nurtures and promotes those ongoing feelings of safety and belonging. There's a lot of, I know myself, a lot of people, when they become new parents, all of a sudden they've stopped working, they're at home with a baby. It can be very isolating in today's society. So it's really facilitating building a community that celebrates the depth of the new parenting transition, perhaps even offering creative art sessions for parents and their children together, promoting things like yin yoga that help recovery, and, you know, things like helping relieve tension and things like that, and perhaps even allowing kids to talk about it, because some even remember their traumatic birth, and, you know, perhaps once a month or every quarter offer a creative art session in the early year settings for parents and their children to do together, to really help with that family connection, and encourage expression, encourage inclusiveness as well. So everyone's welcome, everyone's got a voice, every parent is heard. And there's a saying, what you resist will persist. So if there has been trauma and they're holding on to it, that's going to, you're not going to see it because you can't get into someone else's body. But if they have, there'll be stuff there. So it's really given that almost like putting yourself in that other person's shoes, what would work for you, and also admitting again in the environment of feelings of safety and belonging. So having no cliques kind of thing, try and ensure there's no cliques, and things like, you know, fidget toys can help as well. Jar of lovely affirmations, soothing, relaxing smells that promote safety in the peace corner. And the need to feel safe is so important for supporting a healthy nervous system, especially for new parents, and a place of safety, and perhaps even talking about boundaries as well in when you do the parent space. But I'll stop going on and on, but thank you for listening, and I'll pass on to Abby. Thank you.
Thanks, Lorna, and we'll pick up some of the things that you were just talking about in the panel discussion. But one thing that really came across to me was echoing from Grace's talk, the importance of that community, that village. I think that really did come across, and there were lots of practical tips you gave. So looking forward to hearing about those shortly. I'll introduce our next speaker now, who is Kieran.
Good afternoon or evening, everybody. It's great to be here. Thank you for having me. I'm from Home Start Host, which is a Home Start scheme in Greater Manchester. We are the proud developers of the Dad Matters project. We deliver it in Greater Manchester as part of the perinatal and parent-infant mental health support pathway, commissioned through the NHS, but also with commissions through local authorities and family hubs and maternal mental health services. We're specifically a perinatal service, so we work with dads and male caregivers in the perinatal period from conception to the age of 2. We take referrals from lots and lots of places, including maternity, enhanced teams, health visiting, perinatal mental health, parent-infant mental health teams, talking therapies, self-referrals, and then lots of other third sector organisations. We see hundreds of dads. In the last 2 quarters, we've had around 250 referrals that we've worked with in Greater Manchester in a team of about 5 members of staff. But we see thousands in a universal space. That tends to be antenatal clinics, postnatal wards, neonatal units, mother and baby units, and lots of other places where dads think about themselves as dads. That being the case, it means that we see lots of dads and we speak to them about their experiences, both in universal spaces and in our one-to-one referrals. We share our project across the UK with other Home Start schemes, so we see lots of dads in lots of places in the UK. Up until March this year, we'd seen 1,300 referrals who all accessed one-to-one support with us. We were asked to be expert witnesses in the birth trauma inquiry that ran earlier in the year. We presented some case studies there. One of the things that we really delved into a little bit with the dads we were working with was around acknowledgement. Most men that we come across in the antenatal period approach the antenatal period as a way to learn how to support mum with labour. They are learning about what mum wants, how to advocate for mum's needs, how to support mum with those parent-infant relationships, and a lot of the things that they come across, they think about in that context rather than as their own person and their own as a parent. When that happens and dads experience something traumatic, they often feel that it isn't their trauma to hold, and they want to support mum with experiencing and supporting them through that trauma, without really referencing themselves and what they've experienced and how that might be different. A lot of dads that we speak to will have experienced something traumatic, and they will tell us that they felt it was traumatic and their partner didn't feel that it was traumatic. That again is another difficulty, because there's nowhere really for dads to express that trauma and to explore the reasons behind it if mum doesn't agree. We also think about the acknowledgement of the experience. A lot of men feel that if a professional acknowledges that they are there experiencing that particular situation, the dads are more likely to then try and get support later on, or feel that they can handle the situation themselves because it's been acknowledged that it was traumatic at a very early point. One of the first questions we ask dads that come to us in our referrals is, how was the birth for you? What was the experience like? And we're very curious about answers because, again, they'll answer it in a way that comes across that they are supporting mum or sometimes protecting mum and don't want to burden mum with the thought that dad experienced something traumatic through that experience. We've had dads who've come to us where mums have had emergency cesarean sections and then hysterectomies immediately after the first child. And this had a lot of, there was a few cultural issues around, you know, the need for a big family, the need for that fertility to happen. Also, dads moving countries to be with partners or wives to have a big family, and then that being limited. Also, the lack of opportunity to have a debrief with professionals to explain the decisions that were made and the actions that were taken for the dad, because the mum didn't need a debrief or felt that she didn't need a debrief. We've had dads that have been developed agoraphobia and anxiety disorders, and you know, literally not left the house, not spoken to anybody because of those sort of traumatic experiences. We've also had dads and partners who have felt dismissed by staff, or that they've had staff spoken to them in a way that felt dismissive. So one dad in particular, the traumatic birth had really affected his partner and her well-being, and she was very unwell, and dad went with a midwife to do top-to-toe checks. And when he struggled to answer some of the questions for the midwife, she said that, well, you're no use then, are you? Which feels really abrupt, and that dad obviously took in a way that made him feel worse, that he wasn't the supportive partner that he wanted to be. We explored it with him, and actually the member of staff was probably trying to lessen the stress, maybe trying to lighten the mood, obviously not in the right way. And there's a lot of training and support that we can offer to professionals around how we do that with men, how they might do that together as men in peer support sessions. But in professional ways, we can do that in a much more compassionate way. We can use empathy too. We've had other dads that have gone back into a delivery room and described it as a scene from a car crash or car accident. Thoughts of blood invading their sleep, really invading their working day, affecting their communication with their partner. Flashbacks in PTSD symptoms around those experiences, and it can be really, really difficult to think about from a dad's perspective. We're thinking about how we support mum with those things and not really thinking about the fact that it's going to affect us as well. As professionals, we should be getting supervision, we should be getting clinical support, the opportunity to offload all of the things that we hear from these families that are going through these things. We also need to try and provide that for dads. At Dad Matters, that's what we do. We give them an opportunity to offload, to talk about what's happening. Sometimes with dads with lived experience, sometimes with our trained peer support workers, and also supporting them to advocate for themselves within maternity services or other talking therapies and perinatal services that can help with that too. Some of the other case studies that we've had, particularly around trauma, including things like loss and neonatal units, they describe the fact, again, going back to it, that the dads are really wanting to support mum, and they come to us for a referral in the hope that we can help them to understand how to support mum, and we can explore with them their experiences, which will help them to feel better. We always say you can't help somebody else until you are feeling okay in yourself and able to do that. We have some case studies on our YouTube channel. Please go and watch them. They can be quite triggering, so please look after yourself if you do. A dad who while it wasn't birth trauma, the day after the birth had to do CPR on his day-old baby, and baby was okay. The dad developed PTSD, and the support that we offered him was around getting to know the baby, understanding his role, engaging with services, linking with clinical practice and talking therapies, and accessing CBT. So there are lots of pathways that dads can take. They often don't know about those pathways. They don't know about their opportunities to access support and clinical support. but crucially, they don't know that the benefit and the impact that will have on their family as a whole, and that tends to be the motivating factor for a lot of dads. So when we talk about birth trauma and we're speaking to families, we really do need to try and include and acknowledge dad's experiences in that, and ask them what their experiences are. Potentially, it could be different to mum. Let's try and make sure that we're compassionate and that we treat them as a person that's experienced a trauma. It could be seeing a partner that is very unwell. It could be seeing something that looks quite traumatic. It could be losing a partner or a child, or the potentially losing a partner or a child. There's a lot of different instances that would be traumatic, and it is the person that experiences it that should be telling us whether it is or not. Let's ask them, let's be direct, let's offer them the right support, and let's make sure we know the pathways in our areas so we can feed them into the right pathways at the right time. Thanks, Abby. I think I can hand over to you now.
Thanks, Kieran. So many powerful messages in what you just shared. I think hearing the voices of dads, things that they've said to you, the experiences they've shared, really powerful, and I think very, very thought-provoking. So we'll discuss that in the panel shortly, because we want to support that whole village around each child, each family. Absolutely. I will now hand over to Dr. Lizzie Egbase to introduce.
Good evening, everybody. My name is Lizzie Egbase. I'm an obstetrician and gynaecologist working at the Royal London Hospital in East London. It's a pleasure to be here to talk to you about birth trauma from a clinical perspective. I think I'm going to sort of break it down a little bit into talking a little bit about what birth trauma is, which has really been quite eloquently covered actually by the previous speakers. We'll just dive into that a little bit more. I wanted to bring in a little bit around racial disparities in birth trauma, and also some of the strategies that we're trying to implement within the maternity space and between as healthcare professionals to try and positively impact ongoing birth trauma and also reduce the incidence of birth trauma. So as people have already sort of ahead of me have commented on, birth trauma really is talking about the physical and psychological injury that comes with pregnancy and childbirth, and the impact that this has on mothers, birthing people, and children and the babies that are born. Birth trauma can be split into both the physical, which is including things like obstetric anal sphincter injuries, soft tissue injuries from births like operative vaginal births, Von-Teese births, forceps births, as well as excessive bleeding, complications that come from any type of birth, like a cesarean section. But it also refers, obviously, to the psychological impact of birth. And this is linked to sort of feeling of not being in control, emergencies happening without being feeling that you have even things like expedited birth, so people thinking that having a quick birth is a good thing, but that can be very traumatic for lots of people. Not having adequate access to pain medication, and also not feeling adequately supported or listened to by the mental health, by the maternity staff, whether it be midwives, obstetricians, anaesthetists, but basically by the medical team that are supposed to be looking after you. And there's also some research into the birth trauma and the emotional impact that this may have, emotional psychological impact that this can have on the baby. And there's research looking into the concept that stressful and traumatic births may actually impact infants in regards to their early emotional ability to emotionally regulate, and also may later influence their behaviours and their development. So I think that would be quite relevant to this particular space. So as Kieran mentioned, and I think Dr. Baptie mentioned also, that there's been a recent all-parliamentary group report on birth trauma. And essentially what that report was trying to do is it highlighted as around trying to ending the postcode lottery on perinatal experience. The report was able to demonstrate that 1 in 3 women or birthing person will experience birth trauma. And out of that, 4 to 5% of people will go on to experience post-traumatic stress disorders. The report really identified 4 main areas that contributed to birth trauma. So in the maternity space, looking at things like inadequate staffing, poor communication between from healthcare professionals to patients, insufficient access to pain relief, and unkind care. And most maternity services are very aware of the report. And in my particular unit, we've spent a lot of time trying to implement and embed some of the recommendations that they've put within the report. And I think it's relevant to anybody. And I would encourage everyone to read the report, because actually it really highlights the experiences across England, but also many people can identify with the different experiences that are brought up in the report. And it's always good to know what the recommendations are so that you can advocate for yourself. The recommendations talk around improving staffing, so training more doctors and midwives, which obviously everybody would want, improving training and making training more focused on trauma-informed care, enhancing postnatal support and access to postnatal support, and increasing access to perinatal mental health services. Birth trauma is common. We can see this now from the report and from the many reports that are coming out regarding birthing experiences and the state of maternity services in England. What we also know is that birth trauma, just like maternity, maternal morbidity and mortality, disproportionately impacts women of colour, so Black women, women from Asian backgrounds, and mixed ethnic minority of heritages. There's a higher rate of birth trauma and complications in this patient population compared to white people, but we know that the reasons are rooted in complex social determinants of health, thinking about structural racism and biases. What we know about things like the Egbase report has told us is that Black women, Asian women are more likely to die in childbirth and in the postnatal period, and these are higher morbidity and mortality rates across all economic statuses. But what we also know is that women birthing people from lower socioeconomic backgrounds are more impacted by this. So there is a clear intersection here between race and someone's socioeconomic background. We don't know exactly why this might be. There's sort of thoughts around implicit bias, people feeling sort of not listened to, particularly when they're from ethnic minority backgrounds, feeling that they don't have access to healthcare, not seeing people that look like them within the healthcare space, therefore sometimes building an element of distrust. And there's also this understanding, particularly in the United States, around historical trauma, and this concept that historical trauma can lead to a buildup of cumulative stress, and this chronic exposure to cumulative stress due to sort of consistent racism within society can actually be linked to poor birthing outcomes, including preterm birth and low birth weight. And there's nothing to we can't really sort of dismiss the impact of having a poor outcome on birth trauma. So birth trauma, you might have a healthy baby at the end, but your birthing experience was poor, and that's led you to have a birth trauma. But there's obviously also a population of people that may have a poor maternity outcome. You know, many of the stories that Kieran described that from the dads, you know, seeing complications, emergency operations, pregnancy loss, excessive blood loss, ITU admissions, post cesarean hysterectomy, any of these things could lead to having to lead to your increased chances of having birth traumas. And so when we think about if you're from an ethnic minority background, you're more likely to experience some of these complications. That leads to why this population are more likely to experience birth trauma. So what do we need to do to try and tackle birth trauma? Well, there's this concept of trauma-informed care. And this is really an understanding and an embedding of principles within the healthcare setting, and something that a lot of healthcare professionals are striving to embed within their environment to try and tackle the ongoing issues around birth trauma. The first thing really is to understand and just to accept that there are people that are going to be birthing who already have trauma from outside the birthing experience. Lorna described really beautifully how most people would prepare for their birth, having access to, you know, nice things, supportive groups, writing a birth plan. But some people don't have access to any of those things. Some people are already living in a very difficult environment with no financial stability, no fixed home abode, living in environments with violence, with sexual violence. And these people also are birthing, and they will already come into the system with a significant amount of trauma. So it's very important as a healthcare professional that we understand that. And then on top of that, we may have people that may not have those socioeconomic and social cultural issues, However, they may have had a very, very traumatic first birth, and therefore they're coming back into the birthing system with trauma. It's really, really important that we accept that and we understand that and we think about how we can tackle that. Some of the things that we need to do really is to thinking about how we can build trust with our patients. So providing some of the key safety safe environment, so listening and making sure that patients feel that they trust their healthcare professionals, engaging with them when we are discussing all the different options that that are available to them, and potentially some of the things that can happen in their birth. It's important that we provide not only that, but an incredibly consistent message between healthcare professionals, because often that will be where somebody finds it very, very difficult. One person has told them one thing and somebody else has told them something else. Understanding what patients' boundaries are. So this might be physical boundaries. This may be, how far they want to go within a specific birthing process. Adhering to what their wishes are, making sure that you've given them the risks and the benefits of all the options that are available to them. Ensuring you've got good access to analgesia. And this is, again, is linked to one of the issues around health disparities, because we know traditionally that women from Black and ethnic minority backgrounds have less access to pain medication in labour. And that's because traditionally, or historically, I should say, there was a presumption that maybe these patients didn't feel pain as much. Now, we know that this is rooted in racism, but this actually is a message that has transcended far longer than it should. So, and there was a recent paper that was published by within an anaesthetic journal that was able to demonstrate that even more recently, there's still racial disparities in access to things like epidurals for amongst women and birthing people. So these things really need to be addressed. It's really, really important to think about providing a safe environment for our patients. And so, as Lorna described, seeing people running around in an emergency, that is very traumatic, even if that emergency may not even be for you as a patient. So we think about how we map our patient pathways, ensure that there's privacy for our patients. And like I said before, another really, really key aspect of this is building trust. So trust is built through clear communication with our patients. Setting expectations, explaining each step, and trying to build a trusting relationship. And what's needed to address the health inequalities that come with birth trauma? Well, primarily we understand the importance of cultural competency and increasing healthcare professionals, including doctors, midwives, doulas, that are from different ethnic minority backgrounds, so that patients feel comfortable and so that those other people have an innate understanding, potentially, of what people that look like them are going through. Training to reduce bias is very important. Policy reform, so addressing maternal mortality disparities at a regional and national level, ensuring that we have access, that all patients have access to research, and also ensuring that healthcare systems, whether it's LMNS, local maternity and neonatal system, individual hospital trust or individual hospitals, have strengthened accountability for their outcomes. It's important to develop and to continue to build community support and education. This is particularly important for patients that are from ethnic minority backgrounds, because actually the isolation can be very, very damaging. Additionally, as was recently commented on by the most recent Egbase report, language barriers can be a real barrier to access to healthcare. So building community support groups, ensuring health literacy amongst patients from ethnic minority backgrounds and people that do not speak English is vital to enable them to empower themselves, and also forming groups to empower each other. A lot of women that I look after in East London who don't speak English, are from a Bengali background largely, they don't always have access to the same maternity support groups that women in other parts of England do. And that can be quite isolating. And so in our hospital, we're working on a health literacy project to train and to put as an early research project. So a group of women that don't speak English are being taught over a 6 to 8 week period about pregnancy, what that means from the start of their pregnancy, the whole way through what their birth should look like. And the initial results are very encouraging regarding how this is empowering to this group of women. And it's also really, really important that community support and education that comes not just within the community, but also from healthcare professionals to help build and foster the trust and respect that is needed in the patient healthcare professional relationship. So I think I'll leave it there. I'm happy to answer any questions later on in the panel discussion. Thank you.
Thank you so much, Lizzie. We're really glad to have you here with your medical background and expertise, and I would like to welcome the entire panel to come back on camera now so we can have a discussion based on some of the topics of conversation you've just raised. And I can see some questions coming through already and some comments coming through already from the audience, which shows, I think, how engaging what you're saying actually is. So I can see everyone's back online now. I wanted to start with just a general question about, so when we're talking about birth trauma, we're talking about, as you said, physiological impact and the psychological impact. And Grace really highlighted how the physiological aspect was really the main focus as of recent years. We've expanded that definition to think of the psychological impact. And from Kieran's talk, we're hearing about not just about mothers or the main birthing person, but we're talking about the impact on partners as well, and fathers in particular, from Kieran's experience. So I wanted to ask you a question to the panel. Could you explain from your own perspectives why you feel like it's important for people to be aware of this topic when they're working in the early years, even if they might not be from a medical background? So we're thinking about, I suppose, the impact on the parent as well as the impact on the developing child and the family as a whole. So I am just wondering if anyone would like to kick off and answer that. I'm just trying to see you all in your thumbnails.
I'm happy to.
Go ahead, Lorna.
So what I would say is, in today's society, we don't generally live in connected communities that really help with families. So I think in terms of the early year settings, they could actually be really helpful in this space. It's so unbelievable how much unreal expectations we put on new parents and also existing parents, and pressure to, get going and get busy again and get on the hamster wheel again, incentives to get back to work, and social media, the yummy mummy, and and for dads as well, there's a lot of pressure, and it's like, we don't really in terms of what's there in terms of community and connection, the in early year settings can really help provide and facilitate that kind of atmosphere, if you like, to combat some of these sort of pressures in society, social media, magazines of, people getting back to their perfect size 8 and all that kind of thing. And it's like, well, actually that time is sacred, and that time is vital for really giving yourself time to recover and to consolidate and to transition into a completely, it's a transformative time, really. So
Absolutely. Thanks.
I hope that answered.
I think you really touched on, I think you mentioned connected communities, and that really kind of struck with what many of the panel were saying around that need to have the village around the new parent, around the child, but we don't necessarily have that. But from what you're saying, that's something early year settings can kind of step into that role and provide. I'll just invite, is anyone, Grace, I can see I think you're ready to comment.
Thank you, Abby. Yeah, and just to repeat everything that Lorna said, really, and I agree, it's without wanting to sound repetitive, but those of us working in the early years, we are the chief parts of the village surrounding the family, and there's lots of reasons why a parent might not feel they're able to disclose their birth trauma in a medical setting or with medical practitioners, and even naming your birth as a traumatic experience is a really painful admission. And so it's much, you spoke earlier, Abby, about language and the importance of using language, and even the term birth trauma can be quite a difficult admission. And it can also mean different things. Even in the research world, it can mean postnatal PTSD and refer to the symptoms of PTSD, but it can also refer to the actual experience of a traumatic childbirth. And there's different statistics with different ways of defining birth trauma. As Kieran said in his introduction, just opening up the question, how was the birth for you? It acknowledges and it legitimizes the importance of the birth experience for parents. And it gives parents the opportunity to talk about their birth, how their birth was for them, and in a way that they might not find accessible or possible to talk with a medical professional, especially if their trauma comes from a negative experience with their maternity care during their labour or birth. And so, as both Lizzie and Kieran spoke about the ripple effects of birth trauma on the infant and on the father, and birth trauma is a whole family experience, and it needs a whole family response from providers, not just from healthcare perspectives, but also from early years.
Thanks, Grace. It really made me think when you were speaking about the kind of narratives we give to our children as well. I often tell my children the story about when they were born and what that was like. And I suppose that's something that they internalize about themselves, their entry into the world, and it shapes, I suppose, their feelings of how they came into the world and what that meant for their parents too. So I can definitely see, you can see how that ripple effect can quite quickly spill over into lots of different aspects. I'm just going to see if Lizzie, would you like to come in, or Kieran?
Yeah, I can come in. I agree with what everyone said so far with regards to the wide-ranging impact it can have on everybody, really. I think I was just looking in the chat. I was a bit distracted. Somebody was asking a question around the sort of the evidence around the birth trauma impact on the infant, and I can speak on it from a sort of medical perspective. I'm not a neonatologist, but we already know that if you've preterm births, difficult births, bleeding where babies are born, if they've got low hemoglobins, if they've got hypoxic encephalopathic ischemia, so babies that have had really a lack of oxygen in labour and things like that, they're followed up for up to 2 years afterwards, because we want to look to make sure about neurodevelopment and the development, physiological development. And we don't really know exactly what the long-term impacts are going to be, because babies are being delivered earlier and earlier, and the neonatal advances now mean that your baby's going to live from an much earlier gestation. So we're obviously seeing the impacts as we're sort of developing. But from that perspective, we know that going back to neonatal units, multiple appointments, having to put tubes down your baby's nose when they're very premature to make sure that they're, all these different things will have a lasting impact on one's well-being and psychology. And so I think that we can't underestimate the impact of that on the parent, even after the baby's born, when the baby's at home. And then the other thing that I wanted to mention with regards to birth trauma is the impact it has on the people that are involved in your birth. So healthcare professionals like myself that look after our patients and their families, because I think Kieran mentioned that debriefing and what happens, and often it doesn't happen for the dad, but we try and and it may not be as likely to happen if it was only the dad, because we do things like birth reflection appointments and birth reflection clinics and things. But admittedly, that is something that we offer to the mum, and then obviously the dad can come, but we don't just reach out to the dad and say, does the dad want to come for birth reflections? It's something for me to reflect on about what we can potentially provide for our population. But we also think about the impact that this can have on staff as well, because obviously we want not just well-trained staff, but staff that are well. And so it can be quite a traumatic environment for everybody that's involved. I think often we overlook, because you expect people just go right on to the next one now, keep going. So there's a lot of ripple effect.
Absolutely, thanks, Lizzie. And I just wanted to quickly say I'm really grateful to have this kind of range of expertise on this panel, so we're thinking about it from all these different angles in a way that's looking towards, you know, how we can kind of understand the situation and come to some kind of solutions to support families in a way that's kind of not pinning the blame onto individuals, because it is a very complex picture, people working under extraordinarily difficult circumstances. So, you know, we absolutely value all the professionals who are working under huge pressures. And it's really good, I think, that we can come together in the space and even between us spark kind of ideas and things that we need to think about and reflect on in our own practice. Kieran, I'll hand over to you now to come in and share your thoughts.
Yeah, just reflecting on the we all talk about the village and the people around the family, and often the dads that we work with, they don't feel part of that village. And if you say to the dads, your partner and your family, they visualize their partner and children, and they don't feel a part of it. They're like on the outside helping them rather than part of the inside that needs some support. And so a lot of the way that we can tackle that is much earlier education, much more in-depth engagement of dads in the antenatal period, acknowledging dads at all of the touch points along the journey, because they are there, they're just not really spoken to. At things like booking scans, 20-week scans, antenatal appointments, dads will attend, and they attend in numbers usually. And there might be some that don't, but they're smaller numbers. Make sure resources are really clear that dads are going to experience something that they've not experienced before. It could be great. It could also be really stressful. And there's support there. There's resources there. The dads that we work with who've experienced something traumatic, whether it's a birth or a partner with severe mental health issues or an unwell baby, they tell us that knowing that that could have happened early would have helped them in dealing with it later. And their role in that starts off as a supporter of mum and ends up being a parent, and they're not really thinking about the parenting aspect of it yet. And we can help them to understand that by thinking about parent-infant relationships really, really early, and how dads build that bond with the baby, the unborn baby, and what that might mean for them in terms of looking after themselves down the line, and advocating for themselves in needing things like a debrief or like talking therapies or peer support or whatever that might be.
Thanks, Kieran. Some really important reflections. I see, Lorna, you've got your hand up. Come in.
Thanks, Abby. I was just thinking of the idea of an earlier setting of having a little corner, whether you call it peace corner, connection corner, whatever. And it's just a place when you're dropping off your baby, your infant, you can maybe sit and you're offered a drink, and it's a time to connect to other parents, because when you're a new parent, especially if you've went from working full time to all of a sudden being a parent, can be incredibly isolating, especially if you haven't went to an antenatal course, and it gives that opportunity. I remember when I would drop off my children at nursery, there was nothing like that, and I always wished there was. Just where I could even just sit for 2 minutes and say hi to another parent, and just to connect, because, when you speak to that, you can relate because you've been there. It's different speaking to another parent, and dads as well, can stop by there as well and connect with other dads and share their experience. When you've been there and you've done it, it's very different speaking to someone who's been there and done it and can relate to someone who's on the out, the outside, if that makes sense. And also even offering that space to before the baby arrives, before the pregnancy, before the birth rather, so during the pregnancy as well, so they can, especially if they're planning to send a little one to that nursery, invite them along to connect before the birth. I think just knowing that you've got that support network can help really relieve. So I know that's something that I know a lot of people can worry about, is that isolation after being at home with a new baby. So I just wanted to mention that. Thanks.
I think that kind of touches on the kind of physical isolation you can feel when you're not able to see people and connect in with people. You're rushing and there isn't a space. And also to what Kieran was saying around the isolation of not being able to kind of speak and self-advocate and share your experiences. So I suppose that psychological isolation when you're holding things into yourself. And just hearing you all speak, it's with this topic, I think it's really made me reflect on how my son's going to be 13 next month, and it's made me reflect on how close some of the experiences seem to be, even though it's years afterwards. And one of the things that really struck me is being, you know, obviously, as my perspective as a cisgender woman, is that you feel like you need to advocate very strongly for yourself, to the point where sometimes it feels like trying to think about other people feels like your needs are getting squashed out. So thinking about, you know, making space for dads. You know, Lizzie, you talked about racial disparities, and we've spoken, Grace, you spoke about people who've experienced trauma before. A couple of the panelists have touched on that. Sometimes it can feel like when we are making space for people that we're pushing, you know, we're portioning out kind of needs where it doesn't necessarily need to be that way, I suppose. And I just wanted to see if any of you had any information to share about how, you know, things that we can do to make experiences better and to help people recover. And just for the people that are listening, examples of how we can see making things better for, you know, one particular group of people can help make it better for everyone. Does that make sense? Kieran, did you want to go?
Yeah, I'll go first this time. I think some of the things that dads tell us that would help are, as I said before, being acknowledged, being listened to, validating the feelings. So acknowledgement that the way that they feel is completely normal when they've experienced something that is traumatic. All of that relies on them being engaged with, and that tends to be where the gaps are. The professionals around the family will absolutely be able to do all of those things with that dad if that dad is stood there and engaged with them. Sometimes the dads are not. Sometimes the dads self-isolate. They step away from services. They want services to concentrate on mum, and so move away. So we need to build into our processes ways of making sure that we engage with the dads so that we can ask them how they are. We can tell them what they're feeling is normal. We can educate them about what might happen in the future. All of those things will help, but the engagement of dads isn't normal in the service, in the process, from the beginning to the end. And so we can do more there, I think, as we're moving forward.
Yeah, thanks. And you've really it's really come out to me from listening to you speak how actually supporting the dad, you're actually supporting the mum birthing parent, because that gives them that extra support that you know, when the dad is well supported and their mental health is in a good place, it's going to help the relationship with the infant as well as the birthing person, the mum as well. So I think you can really see how you're absolutely not taking away from anyone, you're enhancing, adding to, and it's tweaks to the way things are provided, from what you're saying.
Yeah. Most mums would report that their partner is the most supportive person in the process, over and above all of the professionals that are around mum. And if dads are not supported, then they're not fulfilling their potential as the full support that mum needs. And the communication between couples can break down after trauma when they don't want to talk about it in the same way, or one of them is ready to talk and one isn't, and that dynamic shifts over time. We see that quite a lot with dads who've experienced loss, where mums want dads to speak and dads aren't ready, and mums push and push and push, and then dads move away from that or back away from that, or the other way around. Dads are really worried about mums and mums aren't communicating with them what's going on, and dads push and push and push to try and get to the bottom of it, and it can affect the communication between the couple, and their engagement then with services around them. But dads can advocate for mums within that space. They can support professionals to understand what mums are experiencing, but they also need to be supported because they're also experiencing it. We can't do all of that in isolation.
Thanks, Kieran. Just opening it up to the rest of the panel and seeing if anyone else wants to come in.
Can I just mention something that I use with my children, and I think it's quite helpful, is thinking of the 3 areas of the brain. And I think of that part of the brain that keeps us out of danger is like a meerkat. I say to my son, "Oh, you're having a meerkat moment." And it's about taming the meerkat and looking after your meerkat, so that the wise owl, you know, the prefrontal cortex can stay in charge. And I think it's tending, and it's part of self-care as well, is, you know, if you're feeling anxious, or, you know, you've suffered from trauma and you're having sort of physical symptoms, you look for ways to calm your meerkat so that it feels protected and safe and cared for. And things like story massage, I was thinking, you know, especially in the early years setting, with a story with the caregivers and the practitioners and children, is particularly effective to get that kind of self-agency back, if you like.
You mentioned agency actually earlier on as well. It's really important, isn't it, in terms of our mental health, and having some kind of feeling that we're in control over what happens to us and what we can do to make things better. And I think the meerkat example is a really good reminder of how, you know, knowledge around psychoeducation and how our kind of how we respond, I think, to things that are hard or difficult, traumatic. It can help us to regain that sense of agency.
Yeah, it's almost like keeping the reins of the horses, you know, and keeping a hold of the reins. So yeah.
Thanks, Lorna. And just checking, Lizzie or Grace.
Yeah, I echoing that, the feeling listened to and accurate reassurance from healthcare providers, and absolutely advocating role of inclusion of partners. When you were asking Abby about some examples of kind of good practice that could be taken forward, it just made me think of a research study that was done a few years ago called the Think Pink study, and I'll try and find it, and I'll add it into the chat. But it was in Warwick Hospital. They had a system in place where during antenatal appointments they would screen for certain vulnerabilities of birth trauma. And those included things like a prior history of trauma, history of birth trauma, or a severe fear of childbirth. I think there were some others in there as well. And women were given a pink sticker on their maternity notes that would have been seen during by all the staff involved in their care during labour and birth as well. And just having that system in place, they saw lots of positive outcomes in terms of reduced referrals to birth trauma services, and actually increased satisfaction across the whole hospital, regardless of whether or not people had a pink sticker on their notes. And so there's this kind of, but the caveat to that is that also all practitioners undertook trauma-informed training, and there was a lot of supervision and support with that. But I think there are these little pockets of good practice that involves all the things that were kind of already brought up about trauma-informed care, trust, building trust and compassionate care. And there's also a lot of evidence coming out at the moment on the positive benefits of continuity of support and continuity of care.
Thanks, Grace. That's really interesting that the satisfaction levels improved for all parents or mothers who experienced care, not just the ones with the pink sticker. Can I just clarify, the ones with the pink sticker, were they mothers who answered those questions to indicate that they'd been through some kind of trauma before and that staff should be aware of?
Exactly. Yeah. They were flagging vulnerability to birth trauma beforehand. So yeah, it was seen by all staff.
I feel like that's a really good example of something that can be done when you're working in a kind of high pressure environment and situation, that, you know, that helps people kind of quickly understand. But as you said, it's supplemented with high quality training, so it's not just a kind of standalone or quick fix. It really needs to be embedded into a system that understands the impact of trauma and then the care as well to provide. Lizzie, would you like to come in?
Yeah, I was going to say, I think that Grace makes a good point about the importance of continuity. Some, you know, we know that the more vulnerable patients need continuity and really benefit from continuity. So when you have people that have perinatal mental health or social risk factors, whether it's drugs and alcohol or you know, homelessness or anything like that, then these are more vulnerable women. They will benefit the most from continuity of care. And I think understanding that, you know, there are a patient population. There's a clinic that runs in my service called My Body Back, and it's a specific clinic for people that have experienced trauma, so either sexual violence or violent trauma, and they go to a specific clinic where they're looked after by a specific midwife and an obstetrician, and that provides them a level of continuity. Similarly, offering birth reflections, because actually you might be able to explain to somebody the aspects of their birth, answer their questions that might help, resolve some of their sort of uncertainty about what happened, why did things happen, and answer those questions early, so as to try and provide them with some reassurance, or particularly important to signpost them on to services that they may need. And so offering that birth, and a lot of places do offer birth reflections. They may not offer, but they're definitely available. So it might be something to try and seek out. And then also, I think there's a huge importance about enabling somebody to have access to community. So whether that is similar to what Lorna was saying, but maybe potentially early on, where it's people that are like them, that have that potentially share a shared cultural background, so that they feel that they they are within community, and also understanding the impacts of different cultures on being able to even speak up about something like birth trauma. So there's a lot of sort of potentially, we understand that the reason why sort of birth trauma, the impact on birth trauma is disproportionately higher on those from ethnic minority backgrounds. One of the risks, or one of the consequences of this, is because of a lack of comfortableness, I suppose, speaking about mental health issues within different ethnic minorities, a distrust for the health service. So feeling like if they were to go, that they wouldn't, or not just the health service, their GP, social, and particularly also if somebody is in the social service, dealing with social services, they might feel that if they talk about their experiences, or talk about how their experiences of PTSD, developing postnatal depression, this impact that this might have already on them, on how they're going to be viewed. So we have to really understand that as well. Some people don't always feel as empowered to discuss what happened to them in their birth. So these are things that can make it quite challenging.
Absolutely. Thanks, Lizzie. That really resonated. I think that idea that, help seeking is a privilege, to be able to feel like you can reach out for help and that you will actually receive help, because some communities haven't received help from organisations that should be able to provide that. In fact, it's been the opposite. And then you've got, the intercultural issues as well there, where someone mentioned in the Q&A actually around stigma, and really needing to kind of help to break that stigma around birth trauma, so that people are kind of feel more able and open to talk about it. I think that's really important. It seems like we need to get that into a baseline for for lots of different people from lots of different cultural backgrounds. We have about 12 minutes left of the webinar. We've got lots of questions, so I'm just going to go and have a quick look at the questions to see if there's any we can answer. But generally, there's a few reflections about the impact of birth trauma on babies, and I suppose that's that makes sense to me that people will be asking these questions, because we know, through parents who can articulate their views, we know what those impacts are for them. But I suppose what we know less about is the psychological impacts on babies, the physiological impacts. I think you spoke about, Lizzie, to a certain extent. I don't know if anyone has any kind of thoughts or reflections that they want to share on babies in particular. Kieran?
Last year we supported the University of Liverpool to do some research, and they're just waiting for publication in BCM, but I have a bit of a review of that. And it was into PTSD symptoms after traumatic birth in dads. And what some of the findings were that higher levels of PTSD symptoms following traumatic birth could impact a partner's relationship with the baby, in terms of the warmth and the feeling that the baby is getting at them, I think was the words that some of the dads used. And we know that will impact on relationships that babies have. And while that's not specifically the trauma on the child, it's a ripple effect, I think, of the trauma that the parents are feeling, and how they then are a buffer for the child's experience of trauma. We know that rupture and repair is a massive part of how babies relate to caregivers. And if caregivers struggle with the repair part of that, then we're going to have babies that aren't able to feel safe within that family unit as well. We also saw that early identification for partners who experience birth as traumatic might provide opportunities for prevention or reduction in PTSD symptoms. So that really early intervention for those will ultimately affect the baby and the baby's relationships with the dads. And we were looking at around 1 in 10 dads after a traumatic birth show PTSD symptoms, but nearly 3/4 said that the birth was traumatic, which is quite a high number from around 300 participants.
Thanks, Kieran. I think that sounds like a really important study, and that impact on the parent-infant relationship really came through there. And it just made me think about how, when as a new parent, a lot of the kind of advice and support you get is around behavior management in children and how to support boundaries and things like that, but less on the parent-infant relationship, particularly when your child might have developmental differences. So I think it seems like there's a real need to support that understanding of the importance of the parent-infant relationship, but also by providing the mental health support and the prevention actually for the parents as well. Does anyone else on the panel, Lorna?
Yeah, just quickly, I was just going to say about the ensuring that staff throughout the journey don't get complacent. They'll go through loads of dads and mums to be and carers to be that treat each one as unique, and find out the background, because it can have such a massive impact in terms of knowing what the unique background of that family is and their needs and things like that. So say, for example, someone puts that they would, even if they have to have a C-section, they want skin-to-skin contact with the baby as soon as possible, and that person hasn't read it and keeps the baby away and starts doing measurements and weighs and all that, that could actually cause trauma during and prolong the time that the recovery happens, and it could cause rupture and things like that and blood loss. And I've heard that happen where there's actually trauma during the C-section because the mum hasn't been given the baby as they've requested and things. So I think, not to be complacent, because it's I think it's the most life-changing event in anyone's life, and it can't be underestimated.
No, absolutely. That importance, like you said, of treating people as individuals, I think that has come up in lots of the research that I've read, irrespective of, the person's background. So very important. Lizzie?
Sorry, I've got something to hit my throat, but there are some papers out there that I think there's one that I saw that was around the impact of PTSD, birth trauma leading to PTSD, and the impact that has on the mother-infant relationship. There was something in the chat that said, is there a longitudinal study? That study was a meta-analysis. There hasn't been like a sort of a longitudinal, something that's covered the same children for 10 years. I haven't found it. I don't know that, but Grace might have a better idea of that. But there are some things out there that are kind of suggesting that. I don't know about what's out there with regards to the impact on the babies, just the direct impact of the trauma on, the physiological, but the direct psychological impact of the trauma, I don't know. I'm not sure that there is much evidence of that yet, potentially, but I do think it's maybe the sort of knock-on impact of, PTSD of parents that, Kieran is also from the dad's side perspective as well.
Thanks, Lizzie. Grace?
Yeah, and just to come in on that, I think the reason that there's not a whole lot of research on the direct cause is because it's really difficult to define birth trauma. We don't have any reliable screening assessments that we use consistently to say whether or not a mother or father experienced the birth as traumatic. And when we do ask directly if parents experience the birth as traumatic, around 1/3 of mothers say that they did find that the birth traumatic. And And often there's this indirect relationship between the birth being a traumatic experience and then that causing a trigger to PTSD symptoms. And then those PTSD symptoms include things like avoidance of triggers of flashbacks, and that avoidance can sometimes manifest in avoidance of the child. And so it can disrupt the parent-infant relationship. And that disruption of parent-infant relationship and kind of sensitivity is what then can have a knock-on effect into things like child emotional regulation. But it's really an indirect relationship. And a lot of parents that experience their birth as traumatic don't go on to develop PTSD symptoms, or they don't go on to develop difficulties with the parent-infant relationship. But yeah, it's that kind of indirect pathway.
Thanks, Grace. We've got 5 minutes left of the webinar, so I thought actually maybe we could kind of come to a conclusion by just asking you all in turn, thinking about people who are listening into this webinar, who are supporting families. They might know that the family has experienced a traumatic birth, or they might not know. What kind of advice would you give to them when they're considering how to support the family best from your kind of individual perspectives and areas of expertise? Shall I start with you, Grace, just because you're already on screen, and then I can go in turn on my screen?
Yeah, sure. And the first thing that came into my mind was making sure you've done some research about what access to support there is available in either in your local area, or what national support is available. There seems to be this rush in research at the moment to find these screening assessments and assessment tools to define certain things, but less focus on where we signpost parents after they've disclosed that they are having difficulties. And so I guess just to make sure there are services in place, and in the resource actually that we'll link to after this, we've put a kind of list of some different services available nationally, but also where you might be able to look for services available locally as well. And I think just having that kind of as a foundation is a good first step.
Absolutely. I just wanted to say that we absolutely advocate, fully staffed services, and someone mentioned family hubs, and yeah, we do, really strongly advocate those kind of joined up services being in place, because otherwise it is hard to have those conversations and open up people to that kind of relaying those deeply, those deeply distressing experiences if there isn't somewhere to signpost them onto. Shall I go to you now, Lizzie?
Yeah, I mean, I think from a healthcare professional's perspective, I think it's really important to be to understand birth trauma, to be open to it, and for us to learn, to know about it, and also to take the time to understand and incorporate trauma-informed care in our practice, advocating for our patients and encouraging our patients to build on their own health literacy, and signposting them to where they can get that information. Making that information as accessible as possible is really, really important, because obviously, we want to make sure that not that people's what they want might change in labour or in the birth, and if they're not sure of how to express that, what to say, what feels right for them, that sort of thing, and then they might not be able to be able to influence their healthcare professionals in the appropriate way, or advocate for themselves in the appropriate way. So I think that's really important.
Absolutely, having the knowledge is important. Thanks, Lizzie. Lorna, I'll go to you next, and then to Kieran.
So I think feeling empowered and informed and understood, and also developing connection in communities to help foster unity, and a sort of atmosphere of compassion and empathy, and removing stigma, so about acknowledgement and acceptance.
Thanks, Lorna. Kieran?
Yeah, I think for us it's all about acknowledgement. It's all about validating those feelings, but exploring those feelings really openly with dads and birthing partners around, this is what some people experience, this might be what you've experienced, really helping them to connect with the experiences rather than the avoidance of those experiences, which we see quite a lot with men in men's mental health. Being very direct, being very open about what might happen, and also even before that happens, let's try and educate, let's try and engage with dads so that they feel part of those services that can help later. One of the biggest problems is that they don't feel part of that pathway, so they don't access the parts of the pathway that can offer that support later on.
Thanks so much, Kieran. And I wanted to extend a huge thank you to the panel. You've all been amazing. It's been a really interesting discussion, and I think that's reflected in the amount of questions that we've got coming through. So some of them have been answered live. Once the webinar ends, you will get a feedback form. So please do fill out the feedback form, because that helps us to understand what we've done well and what we can do to improve for the future webinars. And I just wanted to say a big thank you to our BSL interpreters, Anne-Marie and Lynn, and to the Anna Freud team as well. So behind the scenes, who've been working to make sure that this event has run smoothly. And most importantly, to all of you who've attended. And I really hope there are some takeaways that you can use that will be helpful to your practice. But really appreciate you taking the time out of your evening to join us for this webinar. And please do, if you haven't already, download the resource that we've provided for Early as a Mind that we've produced. You should have all had an email, but it will also be on the Anna Freud website as well. And please do share it with anyone that you feel would find it useful as well. So I hope you have a lovely rest of the evening, and we will see you for the next Early as in Mind webinar. Take care, everyone.